أستاذ الدكتور فيصل عامر، أستاذ جراحة الأورام بالمعهد القومي للأورام. أهلا بحضرتك.
اهلا بيك يا فندم.
كنا حابين حضرتك تكلمنا أكتر على الدايجنوزس والتريتمنت بلين اوف ايرلي بريست كانسر.
اوكي. الحقيقه المؤتمر ده اللي هو ذا 6 كونفرنس اوف طنطا كانسر انستيتيوت. Every year they make a conference to discuss what's new in treatment of cancer as a whole, as general. The session which I was responsible for moderating this session was the treatment, what's new in the treatment of early breast cancer. First of all, as we know that early breast cancer meaning tumor less than 5 centimeter. These tumors previously was treated by modified radical mastectomy. But in the advances of neoadjuvant chemotherapy and in advances of radiotherapy, the treatment is modified so that early breast cancer is treated now by something which is called breast conserving surgery. What we mean is that we take the primary tumor of the breast with a good safety margin, and then we keep the breast tissue. We didn't remove the breast. In addition, we should consider radiotherapy as an adjuvant treatment after treatment of the primary. This is what's new in early breast cancer. Also, as regards the axilla, previously the axilla was routinely dissected of the lymph nodes. But the introduction of sentinel lymph node mapping and biopsy, this will minimize the axillary dissection only to patient who has metastasis to the sentinel lymph node.
What about the new adjuvant chemotherapy?
Neoadjuvant chemotherapy, the aim of neoadjuvant chemotherapy is to give preoperative chemotherapy so that you reduce the size of the tumor so that you can be able to do breast conserving surgery. If the tumor is, for example, 5 centimeter, and if you give the neoadjuvant chemotherapy, it will be shrinked to 2 centimeter, or maybe the tumor will disappear by chemotherapy so that you will be able to give to make breast conserving surgery. Also, it improves the outcome of treatment.
ماذا عن البيشنت سelection؟ هل it's يعني applicable to all patients؟
Yes, it's applicable. It is it depends on the size of the tumor, and the size of the breast. If the size of the breast is small, extremely small, and the tumor is big, this procedure will need something which is called oncoplastic reconstruction. Is to use either, for example, to use latissimus dorsi or tram muscle, transversus abdominis, rectus abdominis myocutaneous flap, and this will depend. What I mean, it will depend on the size of the tumor and size of the breast.
What about the hormonal endocrine treatment?
Hormonal endocrine treatment is used when the receptors, after we remove the specimen, we send it for examination for estrogen receptor, progesterone receptors, and HER2/neu and Ki-67. If these patients, especially in the postmenopausal, if these patients is hormone sensitive, we give them hormone replacement.
دكتور فيصل أشكرك.
شكرا جزيلا.